We're back here on Jones and Company, and we are speaking with young physicians in our country. And as we said at the top of the program, there was a graduation this past week here in New Providence, and there were some 31 persons graduating, 7 postgraduates and 24 undergraduates. And we are joined now by Dr. Deandra Cornish and Dr. Derrel Brennen. Thank you so very much for joining the program. And Dr. Nottage remains with us. And I asked her to stay, really, because she was the valedictorian, and we're going to talk about that in a minute. But Dr. Deandra Cornish, tell us about yourself and your parents.
Okay, so I started my high school. I went to St. Anne's School, the Great Blue Waves.
Okay.
I then went to the College of the Bahamas for 2 years after that. And subsequently, I went to St. Mary's University in Halifax, Nova Scotia, where I studied and obtained a Bachelor of Science in Biology and a minor in French. I also did a study abroad in France for a few months in the summer.
Parlez-vous français?
Oui.
Oui. Okay.
Okay, and in 2009, I applied to the University of the West Indies for medical school, and I was accepted into Trinidad. And I started there for the first 3 years and completed my program this year, 2014, with a Bachelor of Medicine and Surgery. My parents are Mr. Ina Cornish of Cooperstown, Abaco, and my mother is the late Deborah Cornish.
Oh, okay, I know your father extremely well. Okay, Dr. Brennen?
Yes, I went to my entire primary school and secondary school was at Queens College. I then matriculated at Morgan State University in Baltimore, Maryland, where I obtained a bachelor's degree in biology. After that, I went to Florida International University in Miami, Florida, where I obtained a Master of Public Health degree. I then came home for a year and worked, and I applied to the University of the West Indies in Trinidad in 2009, and I was accepted. Completed my 3 years there, then transferred to the Bahamas campus and graduated this year with my Bachelor of Medicine and Bachelor of Surgery degree.
And your parents?
My parents are Philip and Daphne Brennen.
Okay. And you learned how to tie that bow tie at Morgan State, right?
Yes.
Thank you so very much for joining us. And so why did you both choose medicine?
Okay. When I was younger, I always enjoyed going to the pediatrician. It was something about the white coat and always getting the candy afterwards. No matter the reason I went, most times it was for a shot. I remember always getting the candy afterwards. After that, growing up, I also had a great role model in my brother, Dr. Delon Brennen, who always taught me to follow my dreams and my aspirations to do what I wanted to do. He matriculated and went to medical school, and subsequently I had the same passion and did medicine as well.
You are a copycatting fella, eh?
No, sir.
Okay, for me, being an only child, I always said that I dreamt of being a doctor. No one told me, and my father, my grandmother, my mother, they always said that that was the only thing you said you wanted to be. And for me today, it's like, now I'm living my dream, and I always say that it was a dream. It wasn't like by chance. It was something that I said that God had placed in me from a child, and I knew it was what I wanted to do, and now I'm doing it.
Very good. Dr. Nottage, you are the valedictorian, and I'm told that in your speech you said that all of you have reached your goals, eh?
Yes, sir.
All right. Have you really reached your goal?
No, we are just in the beginning stages of becoming that butterfly that we dreamt of being. We are just seedlings on the platform of medicine, but we've gotten this far by prayer and hard work, and it really was difficult. Lots of long nights studying, lots of worry. So when I said we've just arrived. We're just at the door, but
you're at the door.
But we feel a sense of accomplishment.
Yes, there's a whole lot more you would have to do. And when you both are doing your internship in New Providence as well?
Yes, sir.
and you both hope to remain in the Bahamas, along with you, Dr. Nottage, practicing medicine.
Definitely.
Yes.
Because you know the lure is very strong coming from outside the Bahamas. There's a pull
Yes.
coming from North America in particular. Eh?
There is.
Yes.
And I do intend on practicing here at home. I don't know that it will be soon or maybe further in my future, because I don't think it's necessarily a bad thing to go abroad and improve upon the foundation that has been laid already. Perhaps there's an area that you'd like to go and study that is not offered here, although we do offer advanced courses, as you saw with Dr. Knowles, who just completed OBGYN. But if you see so fit to go abroad to improve yourself, to offer even more to your people, I think that that's commendable. And so I think that if we all come home ultimately, that's good. We don't know what the future holds, but I would like to come home. I think most of the UE graduates feel a sense of dedication to the Bahamian people and a sense of ownership of healthcare in the Bahamas because of our school being based here. And the patients who taught us everything we know about medicine have been here. So we owe a great deal to the Bahamian people.
Just to add to what Dr. Nottage just said, it is definitely a privilege to be here and working at home, and the ultimate goal is to be of service to our people. The government and our families and friends have sponsored us this entire time for them to be proud of us and to be back home and working. So to go away and specialize is what we should do, and ultimately come back and give a service to our people as well as our families.
You know, many physicians who are here now, they talk about access to modern equipment or the technological advances in medicine, be it, well, especially equipment, eh? And they believe that if they were in North America or Canada, they would have better access to the technology. How do you feel about that?
Well, for the Bahamas, like mentioned before, we have some of the most advanced equipment as compared to the other Caribbean islands. And we are also known now for medical tourism, especially with our neonatal intensive care unit. So the medicine has definitely been far more advanced than it was in the past, and the care is comparable to or equal to that you get in the United States or any part of North America.
Yes. You know, there are many Bahamians who believe that doctors, physicians are driven by money, by dollars and cents, because of the cost of health care in our country, especially if you are in private practice. I'm sure none of you came into this profession because you are driven by money, right, Dr. Brennen?
No, sir. I think in order to make it in medicine, in order to be involved in medicine, you have to have a love for the job. You have to really care about what you do. Money is not a motivating factor if you can't care about what your patients are going through or feel exactly what your patients are going through and knowing exactly what you need to do in order to make your patient better. So money may be there because of the cost of healthcare is expensive. However, it's not the reason that people go into medicine or stay in medicine.
You all take an oath.
Yes, sir.
You took the oath upon your graduation?
Yes,
Yes,
we
sir.
did.
Tell us about that oath, and whether or not you really feel that, is it the hypocritical oath? Hippocratical oath?
The Hippocratic
Is that it?
The Hippocratic
Oath.
Hippocratic oath. Okay. I add the something else to it.
Right.
Okay. That oath that you took, there are some people who apparently have ignored that oath, or who do not pay too much attention to that oath. People who, you hear people from time to time say, well, you know, I'm not going to operate on that patient unless I'm paid, or unless I know the money is there, or they are insured. Yes? How serious you think a whole lot of people, physicians, take that oath, not only here in the Bahamas, but elsewhere? Hippocratic Oath.
The Hippocratic Oath is the foundation on which we stand. It is the foundation on which the trust that a patient places in a doctor stands. So if persons disregard that oath, they are undermining the quality of what we do and the integrity of what we do.
Tell our public what that oath is all about.
So the initial oath was primum non nocere, which means first, do no harm. Since then, the oath has grown to include things with justice and beneficence, meaning taking care of your patient, doing the best that you can for them.
Mm-hmm.
But the essential part of the oath is first, do no harm. And then we get into discussions of, well, what is harmful to the patient? So ignoring a patient who doesn't have insurance, for instance, you're doing that patient harm. Because in our hearts, our primary purpose is to serve, to make people better, not to harm them, to bring good things to them. So I think that the oath is really very important, very central to how we practice medicine and to how the public goes about trusting us in the practice of what we do, because we interact with people very intimately. We are allowed into a very intimate space, dealing with their personal issues with their bodies. And so I think it's so important that we keep that oath reverent.
We are reminded also that this is a very noble profession. Patients, they trust you. They live their lives with their husbands, wives, children. They know nothing of what they tell the physician. This person knows almost every single detail about their lives, and they trust us. So our duty is to do the best that we can for them and their health. And we also, no matter what the race, nationality, political background, our duty is to do no harm. Mm-hmm. And you have to do the most you can in order to preserve life and treat the patient as a human being, as you would wish to be treated. That's the golden rule. Do unto others as you would have them do unto you. So you would want that also for yourself and your family. So it's only fair and ethical that you treat the patient the way you would like to be treated.
Is this something that you that was taught to you in medical school?
No, this has been taught to me by my family, my friends, the people of my church, my pastors, just a lifelong experience that you have learned that that's the way you treat people.
It's a part of the Christian ethic, isn't
Yeah,
it?
it
Yes. I think going back to what Dr. Nottage said, as far as the patients letting you into their space, there's not many professions out there that you could actually become one with the patient. You basically know everything about the patient. The patient tells you everything that they've gone through, essentially from birth until that point. As far as touching the patient and being in intimate settings with the patient, there are not many professions out there that you can do that. So you have to be trustworthy, and you have to uphold the oath to first do no harm, because you're in a position where you can do harm. But as you said, the Christian morals and the ethics that guide the profession, you have to uphold those.
Mm-hmm. Dr. Nottage, when you were chosen as valedictorian, I guess you knew that you had to make a speech, eh?
I did, yes.
And what happened to you when you were given that honor?
Well, it was an honor. However, it's also nerve-wracking to have to give a speech in front of not only your peers, but their parents and your tutors and persons whom you look up to. So it was a mighty task, but I'm happy to say I did it, and it's over, and it went well. My peers were very supportive of me, and they said that I did a good job, so we're thinking of getting T-shirts that say, "We reach."
There are many Bahamians who are in Jamaica, I'm sure, and other places in the Caribbean. You've left some in Jamaica, I believe.
And Trinidad.
And Trinidad.
And Barbados.
There are other Bahamians who are doing medical training in Cuba.
Yes.
They are having a difficult time, I'm told. And I know it's a controversial issue, but what do you make of the program in Cuba? How do you relate that to the program of the University of the West Indies? And do you think that they should be accorded, or the same treatment that you've been accorded?
Well,
The ones in Cuba, I mean.
I'm not exactly sure of the process or the program that they have, but what I know is that they have a 7-year program, and the first year they initially just learn Spanish.
I see.
And the rest of the time there, they continue their medical education. However, with comparing it to UWI, I cannot comment on that because I don't know exactly what process they have to go through in order to come home. But I do feel as a Bahamian citizen, you should be afforded the same opportunity as any other Bahamian student who went to school at any country in the world, but that you would want to come home and deliver a service to your country.
They seem to think that there is a bias in favor of people who went to UWI. That isn't so, is it? Dr. Brennen?
It's not, I wouldn't say that it's a bias at all. We have more of a relationship with the physicians at home because we train at home. It's mandatory that we come home for our last 2 years of medical school now. So being in the Princess Margaret Hospital and establishing that relationship with the physicians who are in the hospital and who are in the country, it's an easier transition in order for us to go through our education and career.
Do you say it's mandatory that you spend your last 2 years here? So is that you get a benefit that that physicians who are, say, being trained in the United States do not have?
Definitely. Yes, it is mandatory that we come home for our last 2 years now. So it makes it easier on us as far as living arrangements and being able to see family. And in the hospital itself or in our medical career, we interact with the same colleagues that we are going to be with when we finish our career. So it's like I said, it's more of an easier transition.
Yes, and it's less expensive, eh?
Yes.
Yes, and you've all taken advantage of. This is an opportunity that was provided by the government of the Bahamas,
Yes, sir.
in conjunction with the University of the West Indies.
Yes, absolutely. We were afforded, I guess, a stipend or a scholarship to go to the University of the West Indies. And our government supported us a great deal in terms of meeting tuition for that education, which can be very expensive. One thing that I have to say to credit the University of the West Indies is that they make things accessible that may otherwise be inaccessible to large amounts of the population in this region by offering quality education at a lower cost. And our government has helped with that initiative. So I think that we benefited from going to the University of the West Indies.
There are many Bahamians who believe that the University of the West Indies has done a remarkable job in training a whole lot of our leaders in the medical profession. And we don't want to call names here, but we know some of the brightest stars in the medical profession came out of UE, eh?
Yes.
Yes, sir.
There was a time when most of them came from the United Kingdom.
Yes.
And the UK produced the better doctors, you would say, at that time. Now you would say it's the University of the West Indies, eh?
By
I
far.
would say
By
so.
far.
Yes, sir.
You're being biased. There are a whole lot of American-trained physicians here as well
Yes.
who've done extremely well.
Definitely.
Well, congratulations again.
Thank
you.
you.
And I didn't ask you too about inspiring young Bahamians. I'll give you that opportunity as we close. Your role as physicians now, as well-educated physicians, in inspiring the youthful population of the Bahamas, the young men in the heartland communities of the Bahamas, and the young women as well. Dr. Brennen?
I think it's more on us as physicians now, like Dr. Nixon previously said, we are now role models. And it's not for us to just stay complacent and wait for people to come to us. I think it's now that we need to go into the community and find a way to give back to those who may be underprivileged or those who may have found the wrong way. We need to go and reach those youth and to show them that there's another way, that they can follow their dreams and follow their aspirations and be whatever they want to be and do whatever they want to do, and that it can be attained because somebody else has done it before.
Very good. You have the last word.
Okay, just to add to that, what all of my colleagues had already mentioned, that you must continue to remain focused. We do need discipline and encouragement along the way. Me losing my mother at the age of 13 could have been an excuse for me to go the opposite way. But having the support that I got from my father, my grandmother, my mother's family, my father's family, it pushed me in the way that I needed to go. So you have to continue to strive for something. If you have an ambition to be a physician, a lawyer, whatever it is, you want to work and you work hard, continue to work hard, and your dreams can come true.
And Dr. Nottage, you would say that the Bahamas is in good hands, eh?
Absolutely.
Very good, very good. Thank you so very much for being here today. And thank you, Dr. Nottage, for staying the entire program.
Thank you for having me.
Since you were the valedictorian, we thought that you would stay for the entire hour. Thank you so very much.
Thank you.
Thank you for having us.
Thank you, Dr. Cornish. Thank you, Dr. Brennen.
Thank you, sir.
And we thank Dr. Knowles, Dr. Nixon for being here as well. Thank you for watching and listening to our program today. Good evening, everyone.